Senate Republicans say the fully implemented cost of the House health bill passed late Saturday night is actually $3 trillion. Is Obamacare dead on arrival in the Senate as a result? Here now is Republican Senator Bob Corker from Tennessee, who also serves on the Senate Finance Committee. Senator, good to see you.
Good to be with you, Michelle. Thank you.
I'm looking at this statement from the Republicans saying the House bill would spend a staggering $3 trillion when fully phased in.
Right.
You know what the liberal Dems are going to say. You're just a bunch of fearmongers.
Well, but look, you know, everyone knows that this bill is taking into account about 6 years' worth of cost and 10 years' worth of revenues. And the way this ramps up, Michelle, many of the bad things that happen in this bill actually occur after the next presidential election, you might imagine. And the fact is that if it's fully implemented, it really costs about $3 trillion over a 10-year period. So there's no question that a lot of trickery, which, by the way, I want to be fair, both sides have utilized this type of trickery in the past, but this is something that changes our entire health care system. I think it's very important. And when we have so many entitlements that we know $38 trillion in unfunded liabilities in Medicare, we know that this is going to fan that flame and do tremendous damage to our country.
Is this going to get through the Senate?
Well, the House bill certainly has no chance whatsoever of passing the Senate, but here's the way this works here, and I know for your audience who are spending time building companies and all of this, this is kind of arcane, but in essence, they passed a bill out of the House. Now Harry Reid will try to figure out a way to put together a bill that passes with 60 votes, and it'll be different than the House bill. It'll still have the same bad, basic fundamentals. But after that passes, then there's a conference report, and that's where Democratic leaders will sit down. If something passes the Senate, I shouldn't be so quick.
Yeah, I was going to say.
I hope that it doesn't, but the strategy is to get 60 votes in the Senate. I'm certainly not going to support it. 60 votes in the Senate, and then what they'll do is work out their differences in a conference committee.
But can we stall this even more? I mean, if you can get this to the point where they've got to go back, everybody's got to go back and talk to constituents, I think they're going to hear from constituents. You could shoot for this not going anywhere at all.
Well look, that's what I'm shooting for, and I'm part of a team of folks that will be offering amendments. Michelle, a bill of this size, 1,900 pages, with this much impact on our country, we should debate this bill for 6 or 7 weeks. I mean, there needs to be lots of discussion. So I think the notion of this occurring after Christmas is very reasonable when you look at the fact that we haven't even begun debate. We're still waiting on that CBO report. And once that comes out, we should add at least 6 or 7 weeks to that. It should not occur, if it occurs, before Christmas. I think it's great to go home and talk to citizens. That's what I've been doing. I have 10 town hall meetings at the end of this week.
And do your citizens want health care reform?
My citizens are outraged. They want to see health care reform. They want to see something that will stand the test of time, and there are issues that they're supportive of. They don't consider this health care reform because this actually drives up the cost of health care. Most citizens thought when they entered this whole discussion we'd be talking about things that would lower the cost of health care.
Yeah, bending the cost curve.
That's exactly right. And the one provision, Michelle, that you know makes that happen, there's many things that can, and I like to look at all of those, but the one thing is the exclusion on high-cost plans, which the Democrats absolutely will not embrace because
it helps the unions.
The unions across this country are opposed to it. So the one thing that could help is off the table from their standpoint.
Let's put aside whatever you think about abortion, and if you're watching in the audience, let's put aside the abortion, how you feel about it, but let's use it as another issue where I think it is emblematic of what happens when we all collectively pay for each other's health care. We all collectively think we can tell each other how to live their lives. It's never going to end. Whenever anything is perceived as costing the taxpayer money, there's going to be all kinds of rules and regulations about telling us what we can or cannot do. Already over the weekend, you see these groups, the support groups for the overweight, who are terrified that they're going to be vilified because people are going to look at them and say, "You're costing me money."
There's no question that Congress will try to place its values on the American individual. There's no question that that will occur. And look, you know, for instance, in the Senate Finance Committee bill, they set the actuarial standard, Michelle, that is the standard that is the minimum that people have to buy. They say you can keep what you have, and you can until you change. Then you have to buy something that is more than most Tennesseans now have, which automatically is going to drive up costs. So yes, they're putting their own values on our citizens. Certainly the issues that you brought up symbolize that, but more of that will come, and that's of great concern to the people of Tennessee, and I think people all across this country.
We would never tell people, we would never say companies can only sell, automobiles can only be Cadillacs. We can only sell Cadillacs in this country, or Rolls Royces. But when it comes to health care, it seems like Congress keeps saying we can only offer Cadillac plans and Rolls Royce plans, and then they wonder why it gets more expensive and why the poor can't afford health care, because they keep imposing all these mandates.
There is no question, and that's why many of us would like to see more and more competition. One of the things that's in this bill, Michelle, on the Senate side is a 3-to-1 ratio, which means that a young 22-year-old bulletproof person that feels very healthy can only pay 1/3 less than somebody my age, I'm 57, that may have other concerns. But that's the full differential. So you know what's going to happen to young people? Their rates are going to go up automatically, and it's going to discourage young people from entering the healthcare market.
Yeah, it's so wrong. Is this inevitable?
You know what? I have made the statement twice on the floor in the last week that if Republicans had authored this bill, word for word, just like it is, not a single Democrat would vote for it. And my colleagues on the other side of the aisle in many cases have come up to me and said, you're right, we wouldn't. I'm still hoping they will come to their senses. We're going to certainly do everything we can to make that happen. I hear the music. Thank you for the time.
Senator Corker, good to see you.
Thank you.